We all know that for babies to survive, they need the right care. And that is where essential newborn care comes in. And we're going to look at what happens immediately after the baby is born, right from the labor suit. Then we are going to look at how we care them, transition them to home. When do we release them to go home with their mothers? When do they come back? When do we start the vaccination? Some of the danger signs we always look out for. The rights of the newborn, and yes, newborns also have rights. And then we shall look at some of the most high yield things. Now, this is all going to be evidence-based, and we are going to depend on the WHO mostly. My name is Benjamin, I'm from Uganda, and this is Med1Pager, where we try to get all the high yield content and fit it on a single page. Remember, you can download these one pagers at www.med1pager.com. You can catch up with me and my other high yield work that I post on my Instagram, that is Med1Pager. And then there we can interact. You are free to DM me, you are free to comment, and let's get started. So essential newborn care is one of the most important components of care for newborns. And right after the newborn is born, one of the most important things that everyone has to do, every doctor has to know, is that you have to prevent heat loss. And that is very, very, very important. Most of the time, they're going to lose their heat with the water that evaporates from their skin. And you want to use warm towels when you are drying them. And as long as something is soaked, then you want to keep it away from the newborn. So wet linen should not be used on the newborn. Then something that people don't realize actually that it's so important, but the evidence has always brought it out, is delayed cord clamping. You want to wait about 1 to 3 minutes before you go ahead and clamp that umbilical cord. And this is because the delaying kind of increases the amount of blood the neonate is getting from the mom. And as the baby's getting that blood, they replenish their iron stores, and this is going to reduce the rates of neonatal anemia that is going to occur. Then stimulation is another thing that is essential in newborn care. Now you realize that most of the things are crossing over into OBGYN, but also I'm putting them in this neonatology playlist. Remember, we started the neonatology playlist, and this is the third video. If you have not watched the previous video, please go ahead and check them out. Also, if you have not yet subscribed to the channel, I really do think this is a great time to hit that subscribe button and to like this video, because we are going to cover a lot of ground with this new series. So stimulation is very important, and this is from WHO. If a baby is not breathing after drying them, remember the order is going to be, you get that baby, usually they come out, you want to dry them as you wait before you clamp the cord. Now there are instances where you don't do delayed cord clamping, for example in mothers with HIV, if there is placenta abruptia, things like that. Those are very special situations, and we shall discuss them separately. But this is when you are doing that drying, the baby is not yet breathing, then you want to delay the cord clamping and stimulate them. But that should not delay actually your need to initiate resuscitation at all. And if you watch the video about neonatal resuscitation, that you know what we're talking about. So the positioning of the airway is important. Make sure this baby is never bending into their airway. This is something that is very important to know. The baby should never bend into their airway. Remember, babies kind of have a bigger head than their body. So if they're lying flat on the ground, the head is going to naturally tilt forward, and it's going to close off the airway. So you want to always put them in a neutral or in a slight extension, what we call the sniffing position. So we have the skin to skin, and this is the period after the baby is born. Within 1 hour, the baby should receive immediate and uninterrupted skin-to-skin contact with their mother. And this is evidence-based to show and help prevent things like hypothermia. It stabilizes the heart rate and respiratory rate of this child. It promotes breastfeeding and enhances bonding. Remember, the WHO nowadays recommends rooming in. So we have to keep the baby and the mom in the same room. And this is also to help with breastfeeding. So early breastfeeding is very important. And it's important that you initiate it as soon as within 1 hour. And this is going to apply even to low birth weight babies if they are stable. Then to continue, the breastfeeding, it should be continued for 6 months exclusively. So from 0 to 6 months, we encourage exclusive breastfeeding. Now, there are incidences where breastfeeding may not be accepted in some societies. For example, in well-off countries, the baby may not breastfeed if the mother is HIV positive. But in low-resource settings, the risk of getting HIV is outweighed by the risk of dying from severe acute malnutrition. So that is something that you have to always keep in the back of your mind. So we have vitamin K prophylaxis, and this is an important thing if you are going to prevent the baby from developing certain things like the intraventricular hemorrhage and things like that. Remember, babies do not have vitamin K because vitamin K is made by the gut bacteria in the body. But then you find that when a baby is born, they have a sterile gut. That gut has no microbiome. They can't make the vitamin K. They are prone to bleeding. So you want to make sure that they get 1 milligram intramuscularly after the first hour. You may delay it until the skin to skin is done and the breastfeeding is initiated. Then we have the high-risk groups, and these ones must receive regardless of the case. If the baby is a preterm, they have a very high risk of intraventricular hemorrhage, and you want to go ahead and give them the vitamin K as soon as possible. If there was birth trauma, if there are surgical cases, if there is maternal drug exposure, like if they have been exposed to anticonvulsants, you want to go ahead and give the vitamin K as soon as possible. You won't wait. Then we have the eye prophylaxis. This is mainly done with tetracycline, and we use the tetracycline eye ointment, but it can also be erythromycin. And this is very important because we are trying to prevent ophthalmia neonatorum, which is an infection of the eye, and it is mostly due to Neisseria gonorrhoeae infection as well as chlamydia trachomatis infection. And you want to apply this tetracycline ointment within the first hour after birth. So immunization is going to be another very, very important factor. Now, in the West, there are many controversies about immunization, and mothers have requested not to immunize their children. But you realize in my country, like Uganda, we have not had so many issues like that. But again, it's important legally to find out because this can be an issue. So we have the BCG vaccine, the oral polio vaccine. This is polio 0. It's given at birth, as well as the hepatitis B vaccine within 24 hours. So we have infection prevention measures, and these are very, very, very important because most of the neonates are going to die from infection within the early childhood period. Once you prevent infection, you're going to improve this child's rate of survival very, very greatly. So we have measures like hand hygiene. You want to make sure the delivery is clean. The baby should be delivered very well. The instruments should be sterile instruments. And then you have to provide cord care at the end of the day. Some cultures go ahead and have the cord smeared on with different materials which are non-sterile, and this has caused many infections in the past, but now it's reducing. So with dry, you want to give the cord a dry care. Don't put there anything, let it be dry. And in high risk settings, you can provide the mother with chlorhexidine solution, which they will add to which they would be smearing around the cord, and around 10 days normally the cord goes ahead and detaches, and that stamp also needs to be kept clean. So thermal protection is a thing that we started with, but it's very important to continue with it as the neonate grows on. And you have to know the mechanisms of heat loss, that is evaporation, conduction, convection, as well as radiation, and how to prevent it. We prevent it by keeping the baby in a warm room. Closing the windows and doors alone can be a very, very important measure in keeping this baby warm. Skin to skin contact with the baby. We know in malnutrition children or in preterm babies, we give things like kangaroo mother care and things like that. And this can be done by either parent. It can be the father, it can be the mother. Then we can delay bathing, and bathing is delayed up to 24 hours. So you don't want to bathe that baby early until at least 24 hours have passed, because they have a very, very high risk of a very, very high risk of hypothermia. And we know that we bathe them with warm water. That is obvious, but you never know. So the danger signs that we always look for in these newborns: if the feeding is poor, something is wrong. When a baby stops eating, something is not right. Convulsions, fast breathing, anything above 60 breaths per minute is going to be abnormal. Chest indrawing, lethargy, fever, hypothermia, and early jaundice are going to be all signs of sickness. Remember, we have neonatal jaundice, and we already covered the video. It's in the playlist. And early jaundice that occurs before 24 hours is most of the time pathological jaundice. Then the one that occurs after about 3 days is the physiological jaundice. That is just the baby being young, catching up to them. And we covered how we take care of that. So postnatal care, the stay should be greater than at least 24 hours. You don't want to release that baby on the same day. And the contacts, most of the time we contact them on day 1, they should be here. Day 3, they should come back ideally to the hospital. Day 7 to 14, and then at 6 weeks. And then we need to do some home visits. And that is because you want to keep checking on this child. You want to see is the situation better. But of course, I know this is not done in Uganda because of some things that don't make sense. But at least we have the contacts for immunization in the schedule. So every time the baby comes for immunization, they go ahead and they are also examined for other things. So we have the special newborn group, and this is something that I want to talk about. We have the preterm and the very low birth weight babies. These ones need kangaroo mother care, and they need feeding support because they may not be able to suckle very well and things like that. We have the HIV exposed infants. They need ARV prophylaxis, and this is done in Uganda with the nevirapine syrup. And early infant diagnosis is very important. We have an algorithm that shows when the PCR is done, when they can do those things, and we shall make a video about the HIV exposed infant. So we have birth asphyxia. We monitor these babies for hypoxic ischemic encephalopathy. So we have the core rights of a newborn, and this is bringing us right to the end of this video. So all newborns have the right to life and survival. They have a right to essential health care, that is resuscitation, as well as immunization. This is going to be regardless of everything else. They have a right to warmth and nutrition. They have a right to identity, so every newborn needs to be registered and given a name. They have a right to protection from harm, no harmful traditional practices, and this is very important. I've seen babies die because they were done something in the form of tradition when they are very young and their bodies could not hold, and the baby goes on to pass away. The right to dignity and respectful care is very important. The right to maternal contact and no unnecessary separation. The right to equitable care, regardless of the sex, the status, and the disability. And these are all rooted within the WHO organization as well as the UNICEF. So if you really look closely, babies are just as good as humans, and it's very important that we protect them, we give them the right care, and we take care of them. The high yield examples, the things that you have to remember, is that most neonatal deaths occur within the first 24 hours, and hypothermia is silent but deadly. Breastfeeding within 1 hour is a life-saving intervention, and it also encourages the culture of breastfeeding thereafter. Positive pressure ventilation is the most important resuscitation step, and delayed cord clamping reduces iron deficiency anemia. So we have come to the end of this video, and I think we have covered a lot when it comes to essential newborn care. And if this is your first time here, ensure that you have subscribed to the channel, you have liked this video, and you can leave a comment, and I'll give you a shout out in the next video. Now we shall meet in the next video. I hope you have a nice day. Keep reading hard, keep grinding. My name is Benjamin, and this is Med One Pager.